Hola mga katusok! I'm Armae, your Chief MedTech for today, and welcome to the Clinical Microbiology section. This is the specimen reception. It plays the most important role in the Clinical Microbiology section of the laboratory because it is the first point contact with laboratory medicine, and it is where the patient samples are received from different wards, clinics, and other hospitals that are sent to different benches. And these benches are This is the blood culture bench. Patient samples are taken when they are suspected with bacteremia, infective endocarditis, or septicemia. The blood culture bottles are received as pair, one aerobic and one anaerobic bottle. Once received in the laboratory, it is placed in a BD Bacter FX. This is the feces bench, where we process the stools for identification of the organisms that causes food poisoning, such as E. coli and Campylobacter. Antibiotic-associated diarrhea, such as Vibrio cholerae. Also, we do follow-up culture routes by the use of some biochemical tests and serology tests. This is antibiotic bench, where we use susceptibility tests for bacteria to antibiotics with the help of method broth dilution, agar dilution, and disk diffusion. We do susceptibility tests for the significant bacteria. There are some plates that needs to be incubated until 48 hours. Also, susceptibility tests can be done by the help of Vitek 2 analyzer that requires identification card for the identification of the organism. This is rapid MRSA screening bench. It is where patients are swabbed with riot tip swabs and are screened if they carry MRSA. The detection method used is PCR method or polymerase chain reaction method. This is Tigris Gen probe analyzer, which detects nucleic acid of chlamydia and gonorrhea via transcription-mediated amplification. This is the cerebrospinal fluid or CSF bench. It is where we receive cerebrospinal fluid that helps in diagnosis of the disease that affects the brain and spinal cord, such as meningitis and encephalitis. The test looks for sugar, protein, cell counts, and other substances. The specimen is also cultured and microscopy are performed.
This is the respiratory bench. It is where we process samples from upper respiratory tract, including eye swabs, ear swabs, and throat swabs, as well as samples of lower respiratory tract. We use CO2 incubator or carbon dioxide incubator for the bacteria that only grows in the presence of carbon dioxide.
Our walk-in cold room in microbiology, where we keep our culture media and other equipments. the genitourinary medicine bench, where humid vaginal swabs or a urine sample is used to diagnose and treat sexually transmitted infection such as gonorrhea, chlamydia, and syphilis. This is the neonatal screening bench, where we screen newborns for the signs of infection such as sepsis through swabs and other appropriate samples that will be sent in the lab. This is urine bench. It is where we diagnose whether patients get urinary tract infection, kidney disorders, diabetes, or other metabolic disease. A clean urine sample is collected onto a specimen container and analyzed using dipstick test, visual examination, or microscopic examination using inverting microscope, where the presence of cells, bacteria, and other chemicals are detected. We also culture urine on a chromogenic agar, which changes color depending on the organism that grows. This is day 1 wind bench, where all cultures including wounds are examined and colonies are identified via commercial identification test and some biochemical tests. This is the wound and fluid bench. Here we check the samples, demographics, and details, and then we put to the culture media, particularly blood agar or other selective media. We also do gram stains and look for the type of bacteria under the microscope.
Clinical microbiology laboratory plays an important role in patient care by providing the cause of infection and antimicrobial susceptibility data to physicians. Rapid diagnosis of pathogens is important for initiating effective antibiotic administration and improving the outcomes of treatment.